First, let's talk about fixation losses. And I'm going to be talking about these three parameters in order of importance. So fixation losses, it's one of the most important ones. Why? Because if the patient is not fixating in the center, then we don't know where the patient is actually looking at, and we don't know exactly which area of the retina we are testing. The way we can look into fixation points or into fixations are actually several. The more, I would say, common, given the fact that it is the one used at the home free, is the blind spot check, or also known Hell-Krakow method. Basically, what it does is it stimulates the optic nerve area. And when we stimulate the optic nerve area, we expect no response, of course, because there are no photosensitive cells in the optic nerve. So, which means that if the patient clicks when the stimulus is supposedly presented on the optic nerve, that means that the patient is not fixating in the center. And we start counting. This is a very good method. The problem is that it requires extra catch trial. That's the first disadvantage. It makes the test longer. The second disadvantage is that it's very discrete, right? So we cannot stimulate the optic nerve so frequently. That's why when you look into the Humphrey report, you see that it says like 4 out of 8 times, right? So in other words, we don't know during the rest of the time that the optic nerve was checked whether the patient was looking to the center point or not. This is the disadvantage. For that reason, other methods have been developed. And the most common one used is the one that we use on our system, which is the eye tracking system. The eye tracking system is not new. And actually, Humphrey has an eye tracking, it's just that they don't use it for this purpose. So basically, what it does is we have a camera looking into the eye. And if the eye moves, then means the patient is not fixating. So it's you infer that is not fixated, but it's very accurate. Now, the eye tracking can be used in several ways. For example, octopus visual field test or Hexride, they use it to either stop the test when the patient is not fixating or stop the test when the patient is blinking, right? That's very good, actually, approach. The problem with this approach is that it also delays the test because now every time the patient is not looking in the center, then we have to stop the test. And of course, it makes it longer. So at Olleyes, we developed something called dynamic metrics. And what it does basically is instead of counting very discrete fixation losses or stopping the test when the patient is not fixating, what we do is we readjust the matrix of stimulation based on the information we collect from the eye tracking system. And that it's very good because now we don't need to stop the test. Of course, there's always a limitation. If the patient is looking beyond 15 degrees from the central fixation point, we cannot continue adjusting because, of course, the matrix goes beyond the screen, the physical screen that we're using for the stimulation. But it is very unlikely that this happens. Different from the traditional ball perimetry or actual reality, where patients do the test, in the virtual reality, there's no other elements than the fixation point. And for the reason, the human tendency is to only look to the only element in our field of view.